afternoon to my fellow speakers, professors, and students. I am here to give you a deeper understanding about this life-threatening disease caused by a parasite, Plasmodium falciparum. This disease is widely known as malaria. Malaria is transmitted to people through the bites of an infected female mosquito known as Anopheles mosquito. A child may die of malaria every 30 seconds. As of 2006, there were 247 million cases and nearly 1 million deaths of malaria, mostly in African countries. Although there is no vaccine available against this disease, many preventative and treatment methods are available. Travelers from malaria-free area to a disease hotspot are 90% of the global figures for morbidity and mortality are found in sub-Saharan Africa, like I said a while ago, particularly among children below 5 years of age and those who live in the lower income countries. In the Philippines, out of 77 provinces, 65 are considered endemic, and with around 1 million Filipinos at risk of malaria. As you can see in this figure, there are 4 categories of malaria cases. The first one is category A with 25 provinces, and it has more than 1,000 cases per year. Category B with 22 provinces, and it has 100 to 1,000 cases per year. Category C with 18 provinces, which has less than 100 cases per year. And category D, these are the provinces that are already malaria-free and no more indigenous cases at least for 3 years. In relation to that figure, these are the list of provinces with malaria cases. As you can see in this table, Palawan has the highest malaria cases with 17,088 cases and 26 number of deaths. What are the factors that leads to malaria? It can be occupational factors like charcoal making and kaingin farming. Also, the nighttime visits to forest areas can lead to malaria because this is the time where the female mosquitoes look for a host where they can ingest blood meal. Let's go to the symptoms of malaria. It includes central headache, systemic fever, muscular fatigue, muscular pain, back pain, sweating, chills, dry cough, enlargement of the spleen, nausea, and vomiting. Malaria can be difficult to diagnose using only these symptoms because this can also be a cause of other diseases. So in order for us to diagnose if the patient has malaria, he or she should go to a laboratory and have a blood examination to see if the malaria is present in their blood cells. What are the methods for malaria treatment? Before we go to the methods for malaria treatment, we should know first what is the species of the infecting parasite, the area where the infection was acquired, the drug resistance status, clinical status of the patient, if the patient has any accompanying illness or conditions, if she is pregnant, if the patient has drug allergies and other medications taken. So, if we already know that things, we can decide what aims are we going to do. These are the aims in treating malaria. The first one is to alleviate the symptoms which is caused by blood forms of the parasite. With this, we can give blood-transfusicidal drugs like chloroquine, quinine, pyrimethamine, sulfadoxine, and artemisinin. In preventing the relapse,